Day, Nigerians. Good day, everyone, all over the world. It's a pleasure having you join us on yet again another webinar of the Yaba Voice. It's a beautiful day here in Lagos, Nigeria, Yaba precisely, where we are having this wonderful discussion this afternoon. I know it's a pleasure having us come together once again to have this educative webinar. We'll be looking at something very instructive. It's not something that, yes, we all talk about. It's not something that people actually relate to. A lot of people don't. We don't even know what it is. We just know there is a problem. But what exactly is the problem? How do we manage it? What are the challenges? These are things that people don't even talk about. But now today we have something really interesting. You know, somebody called me and said, Kemi, what's happening? You guys are not doing webinars again, is it? I said, no, don't worry. We are cooking something very nice. And you know, when you take time to cook, it's always tastes very wonderful. And I'm sure that you would enjoy what we have packed together for you today. Before we go into the webinar proper, the medical director and the chief host of Yaba Voice webinar, Dr. Oluwayemi Ogun, is happy, ready to welcome us formally to this webinar. Over to you, ma'am.
Good day, everybody. Thank you, our moderator. Today, we are presenting something unusual. Like she said, something we don't usually talk about. We are presenting something educational and workplace. Sorry about that. Today we are presenting something on education and workplace inclusion for people with autism, challenges and opportunity. Sorry, we're having some challenges here. So, during the last webinar, we promised you that we shall present one of mental health problems that starts in childhood, which later becomes a lifetime challenge into adulthood. We at Yaba Voice are doing this to commemorate the World Autism Day that was celebrated worldwide on April 2nd, as it is done yearly. So what is this autism? It is a medical condition that appears during the development of a child. As we call it, a developmental disorder. Autism impairs the ability of the person to communicate, to interact, and this is coupled with restricted or repetitive pattern of thoughts and behavior. It starts in childhood, and though the symptoms may be ameliorated by early assessment as well as treatment, it still leaves deficits in the patient till adulthood. For this reason, people having autism are excluded from educational and employment opportunities, as they are usually discriminated against. As there are educational and worldwide workplace inclusion challenges, so also are limited opportunities which the caregivers of these children do not know about. So to bring to the fore today about the challenges and opportunities of the educational and workplace inclusion for people with autism, we are three experts from our Child and Adolescent Mental Health Service Center, situated at Oshodi Annex of the Federal Neuropsychiatric Hospital, Yaba. The first person is Dr. Mashudat Bello-Mojeed, who is a consultant psychiatrist and a child and adolescent expert. She has done lots of research on children with autism and their caregivers. She's a foundation member of an association founded at the Child and Adolescent Mental Health Services Center. It's called Association for Family and Professionals for Autism Support, HAFPA. It's a group founded for advocacy, raising awareness, and treatment for patients with autism. The second person is Mrs. Tope Amodu. She's a special educationist and a speech pathologist. She too is a foundation member of AFPA, and she works at the Child and Adolescent Mental Health Service Center, where she attends to the needs of patients with autism and other special children. The third expert is Mr. Isaac Osuwa, who is also a staff of the center. He is an occupational therapist. He is also a member of AFPA, and he has attended to very many children with autism, as well as those with special needs. The difference between what we are doing today and other ones that you've heard is that today we bring to this platform two mothers of children with autism who are also members of AFPA. They will be telling us about the challenges of taking care of these wonderful children. Ladies and gentlemen, please relax, listen and make contributions to this all-important topic as I hand you over to our moderator again, Mrs. Oluwayemi Ogun. Thank you very much.
Thank you so much, ma'am. Yeah, I have to tell you that it took the medical director so much to be on this platform today. She had to travel right from Abuja through the rain and every other thing to make sure that she's here by 12 noon. So I want to appreciate you, ma, for this and for pushing and making sure that Yaba Voice moves. Thank you so much, ma'am. All right, so like the medical director had said, we're looking at educational and workplace inclusion for people with autism. If I ask us out there, how many people know what autism is? It might be difficult to have a definition, but today we're going to understand what it is so that when we see children who have those symptoms that will be told us today, we would know that this is exactly what's going on with these children, and not just what's going on among them or with them, it's how to also help them because that would help them to be able to function better. Please know that we are also streaming live on Facebook. So if you can't join us effectively here, please look up with our Facebook page, just Yaba Voice, like our page, and automatically you will be connected to us. And then you can join us and have a view of what we are doing here. And also you can send your comments and questions to the chat box, and then we'll be happy to hear from you and also to take questions that our experts here today would also be dealing with for us. Okay, so moving forward, we're going to be having Dr. Bello-Mojeed start up this discussion today. Dr. Bello-Mojeed, we are talking about workplace, educational inclusion for everyone with autism and the challenges and also the opportunities. Over to you, Ma. Let's have your thoughts on that discussion.
Thank you very much. Good day, everyone, all our viewers across the globe. It's really a privilege and a pleasure having to be on this program to raise awareness on autism spectrum disorder to commemorate 2021 World Autism Awareness Day. And today, we are moving from a lot of information on awareness to acceptance. And that is emphasizing the theme for the 2021 World Autism Awareness Day. That is workplace inclusion, the challenges and the opportunities. But this is a developing country, Nigeria, where we have a lot of issues. And we can't talk about workplace inclusion without the rudimentary skills in the educational level, in the early life development of the affected individual. So we are addressing the educational and the workplace aspects of autism, as highlighted earlier on. So what is autism? Autism is a medical condition, emphasize a medical condition, which usually starts in early childhood, usually before the age of 3 years, but the identification is usually late. Most times, those that are affected are identified in late adulthood or during adolescence or late period of school age. Core areas that are affected for us to understand can be divided into social skills, communication or language skills, and some areas of behavior or interest. For the affected individuals, when we look at the early childhood, it may be on the aspect of the social skill impairment now. For example, we expect to have social smile. Babies with autistic traits may be slow to bring up the smile. Or in terms of the eye-to-eye gaze, which is an important aspect of communication, they may have a total lack, absence of eye-to-eye communication gaze. Or it may be poor, they may have a quality eye-to-eye contact. Some of them are not able to reciprocate emotion, to show that yes, you're playing with them, they're happy, they could see this, they needed to respond appropriately. And in some other cases, it may be on the aspect of mixing with their peers. What do children know how to do well? It is play. And when this difficulty is there, it brings a lot of challenges. They can't mix appropriately with their peers. They may have inappropriate facial expression. Some of them may even lack anticipatory gesture. You know, when you want to carry a baby, you see this gesture of carry me when you're trying to carry a baby. But in them, it is a total lack. But before we look at two other areas, we should know that it doesn't mean that all these features we're talking about will be present in one individual that has autism. It's a spectrum of features that we have to look out for. That is, at an end of the spectrum, it may be mild features we'll see. At the other end of the spectrum, we may see a very severe features. So in terms of the communication impairment or difficulties now, some of them may have a delay in achieving speech, in being able to talk. And some of them may have a total lack of speech. For example, a child of 5, 7, 8-year-old may just be able to mimic sound or give you some distressing sound. And in our environment, about 50% of them from research that we have conducted are non-verbal, they don't have communication at all. For the very fewer ones that are even able to develop on speech or communication, they have difficulty in initiating speech or sentences, or even at the time they had to have the quality of the kind of speech, we'll see a lot of difficulties there. So their conversation is full of a lot of difficulties. They may have some abnormality when they are talking. They may start to repeat words inappropriately. When it is not required that they should say something, they may be repeating something that they have had a long time in the past. And parents will usually describe them that they act as if they are deaf. That is, they call their name. It is expected that when there's a name call, the bearer of that name should turn in response to the callers calling them. But they will just continue doing what they're doing. So most parents will come up and say, I think my child cannot hear. He behaves as if he has hearing problem. Some of them, they are so aggressive when we talk about the behavior. They resist changes in their routine. They don't want anybody to change what they are doing. They may have some motor mannerism like flapping or rocky body movement, or they may just even be biting some parts of the body, and they may be preoccupied with particular interest. For example, they want their toys lying in a particular way. They don't want anybody to change it. And by the time we are trying to change it, they may have extreme distress and they start to throw a lot of tantrum. They may start to bang their head on the wall. And you start to wonder that do they even feel pain? Because at that time, it may be so severe that you may see blood dripping from the head and they still continue to bang their hand on the wall as if they don't feel pain. So they also have sensitivity issues. We have quite a number of it, but the message in this awareness, in the identification issues, that parents really need to know the developmental stages that each child will go through. At the age of 3 months, what do you expect? At the age of 9 months, what do you expect? For example, a child of about the age of 6 months, we expect that this child should pay attention, we should pay attention to babbling. This child should start to babble, mama, baba, but we are not seeing anything. We should monitor the eye contact. At about the age of 6 to 9 months, babies usually will start to pay attention to the smile in response to the caregivers, for example, from the babies. And also, we shall observe how they imitate some of the sounds that we make. In addition to many of those other features as they're growing up, when we're beginning to see repetitive body movements, we should pay attention to it, such as body and rocky body movements. We may have to note some sensitivity that they have to some signs. And even when we have any form of regression, either in their growth or some of the skills that they've had before. For example, a child that started to talk, and suddenly at about the age of 18 months to 24 months, that is 1.5 years to 2 years, this child will start to lose some of the previously acquired skills, previously acquired speech. And we are saying that we need to really watch out for this. When we are beginning to have behavior, such as at the age of 10 months, this child is not pointing, could not grasp, could not attempt to speak, then these are things that we have to watch out for. At the age of 18 months, this child could not say any word. And we expected that the child will have started to initiate even word phrases at the age of 18, at the age of 2 years. And at the age of 18 months, will have started to say about 12 words. And we are having a child of about the age of 3 years, at about the age of 5 years is not speaking, 3 years is not speaking. These are things that we need to pay attention to. And that's why some of the early warning signs that should be paid, that attention should be paid to. No babbling or pointing or gesture by the age of 12 months, or there is no single word by the age of 2 years, or there is loss of any social skill at any age whatsoever. Thank you.
Thank you so much, Dr. Bello-Mojeed. I know that if we leave her, she would go on and on. But you know, it's quite frightening. Some of the signs that she had been describing. You know, when she got to the point where the child started banging his or her head on the floor and blood started tripping out, and even the child doesn't feel it, or he doesn't even know that that is going on. It looks so scary. And I can imagine what would be going on in the minds of parents who have such children. Sometimes you will feel as if, is this child not possessed? You know, and that's what would also inform the pathway to care. How do they go and what do they go to? We'll be talking about lots of other issues too today. We're going to go over to Mrs. Topoya Modu, who's going to share us, yes, what are the challenges as we're looking at educational and workplace inclusion for people with autism. And she's going to share an all part on the educational aspect before we now look at the workplace. And then we'll now go to our parents who are here, and then we'll now look at the opportunities that abounds even for them. Over to you, Mrs. Topoya Modu.
Okay, I'll be talking on the educational inclusion for children with autism in the classroom. Then we are also going to look at the challenges and the opportunities in managing children with autism spectrum disorder in the classroom. Now let's talk about inclusion. What is inclusive education? Inclusive education is the education that includes all children in the same classroom, regardless of any challenges they may have. But some of these children will require the specified, individualized instruction, intervention, and support that will enable them to meet the teaching learning process in the classroom. How do we include children with autism spectrum disorder in the school? First and foremost, what I want you to know as a professionals, as parents and guardians, is that we need to understand the management of children with autism spectrum disorder in the classroom, and teachers need to understand this disorder too, the characteristics, the diagnosis, and to recognize the communication and learning style of children with autism spectrum disorder in the classroom, in order for us to have a full inclusion of these children in the classroom. Including children with autism spectrum disorder involves a strong collaboration between everyone involved in their education. Whether you are a special education teachers, a general teachers, a therapist, doctors, and other professionals working with them. They have to have a strong collaboration in order to make sure that children with autism spectrum disorder are fully carried along in the classroom. Also, for effective inclusion, we need to do something. We need to modify instructions and lessons given to students with autism spectrum disorder in the classroom. We need to modify instructions and lessons given to students in the classroom so that they can learn along their peers in the classroom. With children in the classroom, you can use different methods in teaching them, in teaching children with autism spectrum disorder in the classroom. Sometimes we can sing to them because most of the children with autism spectrum disorder in the classroom, singing is the language they understand most. So you need to sing to them. Sometimes you sing so that they can be well carried along. If you actually want to establish a rapport with these children, you have to sing with them so that they can understand you and give you an attention. A picture exchange card can also be used in gaining full inclusion for children with autism spectrum in the classroom. You can use a picture exchange card to tell you the type of actions you want them to do, and it will enable you to communicate with these children very well in the classroom as a teacher. Now let's look at what Nigeria policy says on inclusion of children with autism spectrum disorder in the general education system. The National Policy on Special Education said that children should be given special attention in the classroom, that for every child with inclusion, that they should be included regardless of their disability, and they have right to qualitative and functional and effective basic education in the classroom. The Universal Basic Education of 2004 provides that basic education is free and compulsory for school-age children, including those with disabilities. Presently in Lagos State, we have 31 inclusive units spread across the 20 local governments we have in Lagos State, and the home managed children with special needs in Nigeria. Thank you.
Thank you so much, Mrs. Temitope Amodu. No, she was talking about inclusion, and from what I got, all children in the same classroom receiving instruction, maybe at different pace, but everyone is carried along. And you know, it was raising question in my mind: is everybody? Is this something that is just like on paper, or is it real? We will still come back to you, Ma, because I know there are lots of professionals, teachers here, who and maybe proprietors, because we tagged a lot of schools, and I'm sure that they're here, and we want to begin to look at how can we do this? How can we make sure that every child is carried along, every child, irrespective of their disability, have access to quality education in a way they can understand it. And if you hear her, she said, yes, you can sing to them. And you know, when she was saying that, I was wondering, the teacher that is still struggling to communicate ABC to these other children, we now begin to see ABC. You know, you can imagine, I don't know if you can get what I'm saying, but then we'll look at all of this, because those are the challenges that we're looking at. And we will now look at how we can overcome all of this there. So we're going to move on in this discussion. Mr. Isaac Osuwa, who's an occupational therapist, is here to also enlighten us on, yes, workplace inclusion. What are the challenges that we have there? Over to you, sir.
Welcome once again, viewers out there. I'll be looking at workplace inclusion for persons living with autism. For Ms. Amoto has spoken about children and school work for them, how to get them inclusive in the classroom. But for persons, these children will eventually grow up to be adults, and having them, when it's time, when they become adults, the challenge becomes what next for them? What do we have in plan for them? It's necessary to begin planning for the future for these children with autism as early as possible so that when they get into adulthood, they don't struggle with transiting into the community. And one way this helps them, that makes it easy for them to live in the community is and achieve independence is through work. And so what is work? Work can be said to be any physical or mental effort directed towards doing or making something. It's also any activity that contributes to the goods and services of a society, whether paid or unpaid. It is one of the major human performance areas that encompasses different life roles, such as being a wage earner, being a homemaker, being a volunteer, and even being a student. It's also something done or made as a result of effort or exertion. Work is a positive and important activity that provides a significant contribution to individuals' meaning and life satisfaction. It is a way of providing reward to support daily existence. Work provides us with a very significant life role, because when we look at it, work takes a third of an average adult's life. Most of us spend at least 8 hours in a day at our different places of work. But for people with autism, when they get older, they are usually deprived of having this time, having this life role. So let's look at why is it important for people with autism to work. It helps them to build relationships and social networks. It helps them to explore and deepen their interests, because believe it or not, they do have interests. It also helps to develop their social and problem-solving abilities. It helps them also to obtain skills and capacities, and also to take up social roles, vocational roles, and also it helps them to earn money, earn a living. And most importantly, doing work is in itself a reward. So it's the right of every individual to be able to meet his or her basic needs and to have equal opportunities as life. This is referred to as occupational justice. But for persons with autism, they are alienated, they are left out, they experience what we call occupational injustice. Because occupational justice comes from the need to do and to be part
All right, sorry, we just lost a signal there. We're trying to do all of that. We're sorry, we are still not in that area where everything just moves all smoothly. Just bear with us. He would come back to talk to us about what work is. And I love the way he defined work. It's not just when you get paid that you're working. Yes, it's an activity that you do that brings out the best in you, whether you're paid or not. This person is functioning. And I hear him say that yes, people work, or yes, you allow people who are autistic to work because we want them to build relationship, because they have interest. I was looking at this when he was talking, something came staring up in my mind, that if we don't build them right in the educational sector, where we're talking about inclusive education for them, then that means we won't get them to functioning. And that's where we must close that bridge. If the educational sector is well handled, or the aspect is well handled, and they are able to function, get on their feet again, then we are sure that they would get a place in the workplace. Otherwise, we're going to be breeding liability that will not be able to function, that will not be able to do anything, and they will not be able to work as well as they should. And also that these people, as much as yes, they have autism, does not mean they cannot solve problems. It does not mean they cannot develop social skills. Does not mean they cannot do all that they need to do in life and other things like that. So that is also very important. And then to take up social roles, they can function, they can live, they can do all that they needed to do. And they know, I love it when he said, love is a work, it's a reward for them. It helps them to be able to function. It helps them to be able to move on. I hope Mr. Isaac is back.
Oh, yes, I'm back.
All right, so please go on. Please go on.
So what do occupational therapists do? Occupational therapists help to analyze the characteristics in the individual and also analyze the demands of the work. Their capacity, it looks at the capacities of the individual, his interests, and also what are the demands from the work. And they come together, bring these two together and help to improve performance in the workplace, because it's necessary. And by in doing so, they help to promote inclusion. They help to promote active participation in the community. And in turn, active participation helps to promote learning, self-esteem, self-confidence, independence, and social interaction. So we'll be looking at what are the challenges when it comes to people with, what are the, when occupational therapists look at work, they look at it looking with different models, and one is the interplay between the person, environment, and occupational performance model. This just simply looks at what are the skills in the person, what are the factors in the person, what are the factors in the environment, what are the factors in the occupation, and even in the performance that could be making this person with autism not able to participate in the community. And there are several, from the person, the cognitive skills, the sensory skills, even to the environment, nature, cultural factors, socio-economic factors, architectural barriers, and also how the work is designed. Is the work designed in a way that it becomes difficult for a person with autism to even get the work in the first place? Because, you know, sometimes you see the interview process could be a difficult process for persons with autism to even get a job. Thank you.
Thank you, Mr. You know, it's what we're talking about today seems like it's really overwhelming for me, because I'm looking at it like we're talking about people that have autism not having issues with being social, connecting with people, and then you now want them to come and say, I beg to apply, and then now start talking and interacting and every other thing like that. You can imagine what it's going to be like for them. It's a big challenge that we're looking at, and you know, it's quite unfortunate that we haven't opened our world and our eyes to things like this before. Sometimes we push people out and say, you know, go away, you're not fit. They're not fit. They're not fit because we have not curated an environment that would make them to be able to fit in. No, we have not done something that will make them to be included in the pattern or in the structure that we are looking at. I think I'm just getting overwhelmed there, but we need to move on. Like, we have two parents here. They're going to share their experiences with us. And for me, they are very real. So you can hear from the horse's mouth what it's been like to have children with autism. We're going to start with Mrs. Rashidat Olatunj. They don't need our sympathy. Please, let's understand that. They need, yes, your empathy, understand where they have been, what they have been through, but no sympathy at all. And then please understand that we are taking our questions and comments in the chat box. So please, you can put that in as we go along. So Mrs. Rashidat Olatunj, please, I want you to share with us what had been your experience managing a child with autism over these years.
Good day, everyone. Thank you so much for this opportunity, for giving me the opportunity to speak up my mind about my child. My name is Rashidat Olatunj. I have a child with autism. She is 21 years old. My child have difficulty in communication, and also parenting a child alone is very, very difficult, and having a child with autism is more stressful. I am a widow and I have 2 other kids aside from my child with autism. So everything has been so difficult for me, taking care of her alone, most especially when I couldn't get her drugs, because she takes drugs every day and we must refill it before one's finished. I have to buy the drugs with huge amount of money, at the psychiatric hospital every day, every month. My child is always aggressive. Whenever she needs something, and maybe she wants to communicate, she needs something and I couldn't understand her, she become aggressive and scream, shout, even bite herself until blood comes out of her body. All these acts and behavioral attitude make me so overwhelmed and anxiety, make me feel a lot of anxiety every time that I couldn't focus on my own life myself. I cried a lot of times seeing my child behaving this way, because even going out with her, I find it so embarrassing and difficult when she starts behaving unusual, touching people inside the bus. And a lot of people don't understand what we call autism, children with autism. Autistic children, autism is not a disease, but the discrimination in our society is very, very much. We've gone out one day, when maybe the day we were going to clinic, we entered the bus, my child started a behavioral attitude. The passengers started coming down one by one, and one bus stop after the other. This made me so overwhelmed that day till I busted into tears in the public. I felt so depressed. I felt so exhilarating most of the time. Taking care of a child with special needs is so hard. It's one of the hardest jobs in the world. So my child bites herself whenever I couldn't give her drugs. And also whenever she needs something and she wants to express herself, she bites herself, scream. The next thing I do to reduce the scream in the neighborhood is tie her hand, use clothes to cover her mouth so that the screaming will reduce when I couldn't do anything again. I felt so scared most of the time. Now, what am I going to do with this, my child? This is becoming so severe. We visited the psychiatrist. The only solution to it is to manage a condition with drugs. And this is why parents with special needs children need full support. We need words of encouraging from people. We need love. We need financial support. But a lot of people don't understand what we are going through. I personally, as a parent, I felt depressed. I felt so sad every time seeing my child this way. My child doesn't even understand what we call menstruation. Whenever she starts her menstruation, if I try to pack it with pad, she will remove it for me and throw it on the floor. And if I try to force her to put it back, she will scream. She always wants to do whatever she wants herself. She wouldn't listen. The only thing she can do by herself is just take the spoon and eat, then sit down at home. But I know if I'm going to take her to therapists for more treatment, or maybe any occupational or maybe psychiatrist, is going to cost a lot of money. In Nigeria here, in our society, we need support. There is nothing like that here. So this is part of my stress, part of my depression. My child is always like that. And also, the act of biting herself until blood comes out of her body makes me unhappy every day. I'm still battling for her. She's 21 years old and I'm still battling for her. She is 21 years old and she couldn't even do anything by herself. Having a child with autism is not easy at all. It's very, very difficult. So I don't have much to say about my child, but I thank God. I hope one day she can have a better life, because I always think about our future. Our future is always giving me much concern. Is she going to continue behaving this way till eternity? What exactly is the treatment I can give my child to become someone in life? She's there at home, sitting down there. I locked her up because I couldn't open the door for her. Anybody might go in and do anything for her. So she couldn't talk. She only hears whatever we say. So thank you, everyone. I thank you for this opportunity. Thank you so much.
Thank you so much, Mrs. Olatunji Rashidat. So much emotion there. It's really overwhelming here where we are transmitting from. You know, the child becomes aggressive because she can't communicate and she wants to get things. She's not able to express. You can imagine the frustration the child has in trying to express herself. And then we would also begin to know some of those things. It's really overwhelming. We're going to move to the next parent here too, who is going to also share her experience with raising a child with autism. Over to you, Mrs. Ijoma Ugu.
Good afternoon, everyone, wherever you're watching from. I am Ijoma Ugu. I am here as a parent. So I would like to point out that if this should serve as an awareness, we would like to let the public know that the majority of the challenges we have raising children with autism can actually be alleviated by people around us. How do we do this? By just showing your understanding and your empathy. Well, my child is not as severe as my fellow mother, but even at that, when we go out with them, the kind of look we get is more piercing than a sword. You could be empathic, just look at the child with some kind of kindness. It makes the mother, it makes the burden a lot more bearable. You could just, even if you don't have anything to say to them, just be kind. Don't mope, don't gaze, just walk away. If you don't have anything good to say, don't say nothing, just go. We've had encounters where people would approach you to let you know how bad a parent you are, how you're not flogging your child enough, how you're not teaching your child enough. But let us just know today that this is not the fault of the parents. As at 10 a.m. this morning, people don't know what exactly causes this, and no one knows how to cure it. So to people out there, to fellow parents, to relatives, to friends, the best you can do is to understand and to show empathy. When we are shown empathy, when we are understood, we can do a lot more, both as parents and as children. When we talk about challenges at workplace, we would want to let people know that even at school, when we talk about policies, for us, they are just words on a piece of paper, because it is also challenging to the child to cope with the normal environment of the classroom, where every other child is there, maybe talking or doing their own thing. Sometimes they can't really take up all the information on themselves. You see some of them closing their ears or just screaming. And then to the teacher, him or herself, it's a big challenge, coping with 20, 30 children, and then still paying attention to your child. So what some parents who can afford to do is that they end up employing an extra hand who takes the child to classroom. But this is not something that every family can afford. So it still falls down to the system. What plans do the system have for children like this? You can't just say this child is entitled to education and you don't make provisions for that. Many schools will still reject us. You still go to so many schools and they still tell you, I'm sorry, I can't take this child. And sometimes it's even fellow parents that request that you do not put such child in their children's classroom. And if you refuse, if a school refuses, they will withdraw their children. And then if it is a private school, they have no choice than to ask you to come take your child because you are spoiling business for them. So what do we say about workplace? As far as our society is concerned, yet we don't know nothing about workplace for these children. And like the occupational therapist pointed out, working rewards you with self-esteem. everyone feels good when they feel they are contributing to the society. But these children, they grow up 20, 30, 35, and they don't do nothing that's rewarding at all. They don't have any job. They don't even take care of themselves because even as children, they were not able to get the proper support to train them. How many children have access to occupational therapy? How many children have access to speech therapy? As many of us that come to the child and adolescent mental clinic, it's just a tiny fraction of people out there that need the services. And even at that, the hands are being overwhelmed. You could get an appointment once in 2 weeks. How is that going to really bring the child to the level they need to be? So what we are saying is we need a lot more support, both from the system and both from the society. We need this support, not your sympathy, like the moderator pointed out. We need your support and your empathy. Please provide it wherever you see the opportunity. Thank you.
Thank you so much, Mrs. Ijoma Ugo. That was well delivered. Yes, they need your support. They need your empathy, not your sympathy. Don't look at them like they have lost it. The first time I watched a movie like Stars on Heart, it shows what children with disabilities go through, the challenges, and it gives an inroad into their world. I would encourage us to watch that movie. It would tell you that, yes, if every child is properly trained, spent time with, they can always become the best. Now we're going to go over to Mrs. Semitope Amoju, who is going to share with us what are the opportunities. Yes, we have talked about all of those things, but what are the opportunities? We don't have so much time, but it's important that some of these mothers share their thoughts, and then we can understand their pain and their feel. What are the opportunities that, yes, we have around in our world?
Encounter challenges in the classroom. As a teacher too, I want you to know that we encounter challenges in the classroom too, in order to make sure that children with autism spectrum disorder is fully mainstream in the regular classroom. Now, looking at the triad of impairment in autism, the major characteristics of these children is the challenges we face as teachers in the classroom. When we talk about communication, for a child with autism spectrum disorder, some of them does not talk and some do not and some talk. So it is difficult for us as a teacher to communicate with these children. They can't successfully communicate and interact with other children in the classroom too. So also, these challenges varies like that and it comes in different way. Now, there are, aside these challenges for children with autism in the classroom, we have opportunities that they can benefit from. So let's look at the opportunities that these children can benefit from in the classroom, including persons with children with autism spectrum disorder in the classroom. Before you can gain their attention, you need to do a variety of instructions to give them full inclusion into the classroom. The first thing you need to do is to establish a rapport. You cannot just go to a child with autism and say hi to him or her without you establishing a rapport first. You need to establish a rapport in a routine way that the child will be so used to you. Then you use direct instructions to communicate with that child. And sometimes you have to use a playway method in order for you to gain the attention of that child in the classroom. Then you also use rhymes to build the vocabulary of a child with autism spectrum disorder in the classroom. Most of these children love it when you are singing rhymes to them. While you are singing rhymes, you make use of your visual method to teach number concept. 1, 2, I love you. 3, 4, let's have some fun. You will see that they will be interested in you. They want to give you attention. They want to see what you are doing. And you can also teach letters using plastic ones. They love to touch things. And if they love to touch things, it gives them a reliable sense of what they are doing. They want to feel, they want to touch and do things in their own way. And letters can be taught by letting students to feel things on their own too. Children with echolalia that falls on the autism spectrum disorder, sometimes they memorize sight words and listen to things that you say. Then you give them flashcards so that you can drill them on those words so that they can improve their vocabulary in the classroom. Also, in the classroom, another opportunity for them during inclusion is that it provides individualized educational plan for a child with autism in the classroom. For a child with autism in the classroom, you'll be able to plan knowing the baseline of that child, then you'll be able to work on it so that you strengthen the child in the classroom and you also mainstream that child with other children in the classroom. Then you'll be able to adapt and modify the curriculum for that child. So in the classroom, while you're doing this you are actually going for full inclusion of children with autism in the classroom. Then you allow students to type on iPad sometimes in the classroom. You make sure that their fine motor skills are properly in place. Then you make use of their grip, for them to be able to coordinate instructions and keep going very well in the classroom. So what are we now saying? For full inclusion, it is important that all educators are well informed on autism spectrum disorder in the classroom, and so that for you to have a successful strategies to use to support them in various schools. Thank you.
Mrs. Temitope Amojo, she had ruled out a lot of things, and I am very sure that those of us that are in the educational sector, you have been able to pick up on that. Yes, direct instructional playing method and other things like that, but then it has to be individualized to ensure that each child learns appropriately. Mr. Osuwa, can you tell us, yes, what are those opportunities when we're talking about the workplace?
Thank you, moderator. For people with autism, promoting inclusion in the workplace, we have to start with helping these individuals develop skills necessary for the workplace, and this can be done through pre-vocational skills training. This involves training cognitive skills and communication skills, work-related skills, safety that they need, that these individuals need in the workplace. It also involves exploring their interests to see, okay, what can this child do? What interests does this child have? And also we can also create inclusive surrounding environments, make the environment much more inclusive for people with autism by having things like sensory rooms in public buildings for them. So that way, when children, like the other mother stated, when children are having meltdowns, there are places they can go to. For work also, they can benefit from a sheltered employment. A sheltered employment is one where these individuals are gathered in a place and they receive training and also get paid for their work. We have something similar in our hospital here at Yaba, where adults with autism can benefit from. Also, they could also benefit from supported jobs. In supported jobs, what happens is that these individuals are placed in communities. They are working in the community and they have professionals supporting them. So beyond just integrating these children, these individuals, we have to make them active participants in the community, and it takes all of us to be a part of this, including government policies and the rest. Over to you, our moderator.
Thank you so much, Mr. Isaac. He had told us what we need to do to have an inclusive workplace opportunities for people who have autism. Yes, there is a question here on the platform, the differences between autism and Asperger. Dr. Bello-Mojeed is going to answer that. And also, is autism a developmental or a bad disorder? And what is the remedy, Dr. Bello-Mojeed? Please take that.
Thank you so much for that question. It shows that people are really with us and everybody wanted to know about autism. Autism, Asperger's, these are different terms. Remember when we started this discussion, we said that autism spectrum disorder, usually referred to as autism, is a medical condition with symptoms, features, things that we see as if we have an umbrella dome this way. At an end of the spectrum, we have those that the symptoms are mild. When we say mild, it's just to describe how severely affected an individual is. At the other hand, we have those that are severe in terms of impairment. So when we talk about Asperger's, we are talking about those individuals in the autism spectrum disorders that have mild impairment. For example, the aspect of the communication or language, we said many of them, about half of them in developing countries like Nigeria, do not even develop speech. In Asperger's, we have high functioning in terms of the language, and they have some, we are saying that the language or the communication is sparingly, spared, is not as affected as those that are severe. So they are able to have a very important talent in terms of how they communicate, and they're able to achieve better, maybe in terms of an area of communication or language. But when we talk about autism, most times, it refers to everything, but the severe one is the autistic disorder. In the previous diagnosis, we don't want to go there. But autism is an umbrella that encompasses everything. Then the other question is it a birth disorder or what is it? Autism is not a birth disorder. It is a medical condition. What we are saying is that the possible factors that we call possible causative factor, the actual causes are not known, but there are factors that have been identified to contribute to why a child may have autism. So before the child is born, during the period of birth, or any of those, we may have some factors that may explain the possibility of a child coming up with autism. For example, infection. Some, it may be viral infection, or the use of some chemicals that are referred to as teratogens. Some, it may be because there are some viral infection like measles. So it's not a birth condition. And when we talk about the remedy, we are talking about the possible prevention. The first thing is, before, there are a lot of things. You may still need to have another program, but we talked about parental age. And we try to encourage people to get married early, although there are a lot of controversy on that, because advanced age of mother or even father have been suggested to play a role in development of a child or having a child with autism. We talked about even the use of folic acid during the reproductive years, or when a childbearing age female uses folic acid, it may actually be protective. And we also talked about the need for us to ensure that we take good care of ourselves during pregnancy. We don't go to where we'll not be able to have quality health care during the antenatal period and many more. Thank you.
Thank you so much, Dr. Bello-Mojeed. She had been able to tell us, yes, some of the things that we can do to ensure that at least to a greater percentage, we're able to safeguard the child that is born. Ms. Temitope Amodu, there's a question here. Is inclusion possible to all patients with autism? Someone wants to know, is inclusion possible to all patients with autism?
Okay, thank you. Inclusion is possible to all patients with autism. It depends. Looking at the educational system we have in Nigeria now, the government is trying their best. They're trying to put everything in place. From LASODA, we have centers all over the world now, all over the state, especially in Lagos State. So where they are trying to make sure there's full inclusion for children with disabilities, including autism too. So we are all even at our center here in Yaba Psychiatric Hospital, we are trying to run an intervention program that will make sure that everybody is inclusive in all the programs we are doing. So we are all trying our best. Inclusion is possible. Thank you.
All right, thank you, Ma. Mr. Isaac Osuwa, somebody said families of children also require support and other intervention. Yes, we heard about the burnout and every other thing that happens to them. What intervention are available for these parents and caregivers? What are the possible interventions that we have for them? Are there things that we can do for them too as parents and caregivers?
Yes, definitely. There are things that can be done for parents and caregivers of children with autism. There are, like most of the mothers they have said, what they basically need is support, because the social stigma is one of the major problems they have. But there's also the support from support groups like the AFPA that we have running in our center. It provides support for parents, for caregivers. They can meet with other fellow caregivers and share their experiences and learn from each other. Also, for parents who may be undergoing burnouts, they may have to see psychologists to help them with psychological interventions to help them with this burnout. And occupational therapists also could help them with planning the daily routines for their children and make it less burdensome. It could help them with addressing life problems that and gaining life skills that can reduce the burnout that they may be experiencing. Thank you.
All right, thank you so much, Mr. Isaac Osuwa, for that. Dr. Bello-Mojeed, someone is asking what effort can be made to protect these children from being rejected from school? What can we do? Do we need to shout louder? Do we need to talk more about this? What can we do to make sure that these children are protected and they are not sent away from school?
Thank you very much for that question. Not being sent away from school. In answering that question, it is very important to know that it's not even all persons with autism that have access to school. So access is a major barrier. For the fewer ones that have access to school, then what do we do to ensure that we eradicate rejection? It's a very big question. And all hands needs to be on deck, including you, the viewers, the listeners, and I, and all of us. Every organizations need to come together to work hand in hand to ensure that this inclusion we are talking about is not just a paper-written work. For example, in Nigeria, we've listened to the professionals and the parents. I'll give an example with the first parent that spoke. This child, okay, she talked about that the child is only drug they use. It's because we're talking about the severity. Because this child has also benefited from behavioral intervention at the center. She has benefited from social intervention at the center, including psychological intervention. And many of these, we even had to get well-meaning Nigerians that even supported financially with the medications. But it's not as if every parent will have access to this or it will be lifelong. So that aspect of the rejection, the government needs to come together. There has to be a strong policy in place, a strong policy that will be backed up with action. When we talked about this policy, there had to be empowerment somewhere. Somebody will have to pay for many of these services. Because for those that don't even have what it takes to have inclusion in terms of education for the affected persons, then they may need to go to other services where they have the facilities and interventions. But affordability is a problem. So they are rejected, it may be because they don't have the money. So somebody will have to pay for it. All the organization will have to come down, and everybody needs to destigmatize the aspect of the autism, and everybody should accept them and show love and show the acceptance for them. Thank you.
Acceptance is key. That's what I heard Dr. Bello-Mojeed said now. Accept them. It's not that they have something bad going on with them. Accept them just the way they are. That's what had happened to them. So accept and show love and support the parents as much as possible. But then again, I'm going to come back to you, Dr. Bello-Mojeed. Somebody's asking, can prolonged labor be a cause? Can X-ray, penetration, or radiation be a cause of autism and other things like that? What they want to know, is there a cause, a known cause of autism?
Talking about the possible causes, and questions are coming from the frequent things that we see or that we heard around us to have been implicated. Radioactive rays, right? And we also talked about prolonged labor. The aspect of prolonged labor is something that can never be overemphasized, that we need to get educated about. That is birth and pregnancy related problems. For autism, we said the actual cause is not known, but there are some possible factors that work interrelationship. For example, let's say we have like 10 fractals. You can see my fingers intertwining. So we're saying that many of these fractals work together, and after that interaction, they may actually come down with autism. But out of these, all the factors that we talked about, genetics is the one that is the strongest that have been implicated in a child developing autism. That is, if we have the gene implicated for autism, the child may actually come down with autism. The environment, we have a lot of toxins, we have chemicals, we have preventable possible factors like birth complications, infection, and all that. So, but we can't just say that during prolonged labor, there are different consequences, negative ones that may occur, but that is not the most implicated for autism. Genetics is most implicated. Thank you.
All right, so there might be other possible factors or other possible reasons why it could happen. But Dr. Bello-Mojeed has told us that it's genetics, that it's the number one thing when you're talking about autism. All right, so from our presenters today, we're going to be taking the final words. I know, yes, there people would still love to hear more, but then we would have to talk more too, but then we have to just wrap up at this point in time. I'm going to start with Mr. Isaac Osuwa. What's your last word to people out there who are going through this challenge? What's your word for them?
I'd just like to encourage them that one day there's light at the end of the tunnel, as long as we keep speaking up for these individuals and ensuring that we fight for their rights. Let me put it that way, because it goes beyond just training the individual. The society, the environment also has to accept the individual. And so we like I said, the environment too has to be modified to accept this individual. That's just what I have for us. Thank you.
What we're saying is let's create an enabling environment that would have allowed them also to be included. Mr. Mitopoya Modu, what's the word for us here today?
Okay, thank you. I'll say that the society at large and everybody needs to appreciate and show love to children with autism spectrum disorder so that they can learn and benefit from what every other person is enjoying in the environment. Thank you.
Thank you so much. Yes, Dr. Bello-Mojeed, what's your final word for us here today, ma'am?
Okay. Thank you. Yeah, there can never be a short final word, but we should know that in raising awareness for autism spectrum disorder, we said it is a medical condition that ranges from the symptoms or features being mild to being extreme. And during this pandemic, these children, the persons, the family affected by autism spectrum disorder, they really felt the most severe part of this impact of this COVID-19. And moving forward to the post-pandemic era in developing things that will help us to heal, we should remember that inclusion is important in all aspects of their functioning, education, workplace, and despite these disabilities, they have a lot of disabilities. And that is why we talked about neurodiversity in the management or in moving forward in including them. We should know that there are some companies tapping into the benefits of the skills and ability of neurodiverse talent pools such as autism spectrum disorder. And we want Nigeria to move forward and do something for them. We start from acceptance, we reduce stigma, and we all work together to ensure that they have a better outcome and a better living for everybody affected by autism spectrum disorder.
Thank you so much, Dr. Bello-Mojeed. You can see our passion coming to the fore, but we want to wrap it up at this point in time. I want to thank everyone once again for being part of this webinar once again. Thank you for always coming. Thank you for always yielding and sharing out some of this information. We know that we can't even get across to so many people, but you do that work for us. Please like our page, Yaba Voice, one word. Just type it there on Facebook. We're there, Instagram, and on Twitter. And then please, you can just like our page and automatically automatically you become a friend of us, and then you can follow and see whatever it is that we're doing. Thank you so much for being part of this webinar once again. Please, let's accept people with autism. Let's support them. Let's show love and kindness to them. Let's make sure they're included in our world, and then we make them as happy as possible. And until we come your way again, where we'll be looking at something very also pertinent that is happening in our world. We'll be looking at the issue of cannabis, ganja, weed, igbo, whatever name that people call it on the street. But that's what we're going to be looking at our next one. Until then, please stay safe and ensure that you show love to everyone around. On behalf of the medical director and everyone on the Yaba Voice team, I'll say thank you for being part of this webinar. Take care. We will send out, yes, it's going to be on our pages. The recordings for this program is going to be on the Yaba Voice page, so you can also access that too. Thank you so much. Bye-bye. Have a lovely day. God bless you.